We're going to get started in just about 1 minute. So I hope you guys are excited about this episode that we're going to be talking about it, because you'll find it completely fascinating. What's so beautiful is that this is it's 3D, it's live, which means that there's no question once you take some blood out of you and you put it up on a screen, then you have 100% believability, because it's not factual anymore. It's not fiction anymore. It's factual, which makes a believer out of anybody, even when they don't oftentimes have a little bit of skepticism about these things. So you'll find it really fascinating. So it's 5:30, so we're going to go ahead and get started. So once again, welcome to the Perfectly Healthy episode number 8. And we're excited to have Dr. Shannon with us this evening. And again, we are looking forward to her expertise and how she would utilize live cell, with her patients. Theresa is our expert. She is the live cell therapist. I've done that as well. Microscopy, we do it a little different because she has both dark field and phase contrast, where I only had phase contrast. So her what is it?
Microscope?
Her microscope. Okay, my brain went dead for 1 second. Her microscope is a little bit more, not so much powerful, but it'll give more information. And she'll talk a little teeny bit about that as well. All right, so I'm going to go ahead and without further ado, go ahead and share our PowerPoint with you. So give me just a second here. Oh, so right. Okay, so I think we have a little blurb on everybody here. So I'll just kind of start out with me. I've been at the Center for New Medicine for going on 20 something years now. And so I feel like, Dr. Keneal and I have grown wise together in so many ways. And, one of my roles here is to work with our patients, creating foundation in regards to their lifestyle. How they eat, how they think, how they move, how they sleep, how they eliminate. And then from that point of view, from the matter, then we move to the emotional aspect. So things that are the unseen. So I also do EVOX, which is an emotional based biofeedback therapy that's looking at generational trauma. We don't come in with a clean slate. We come in with generational patternings that are from mothers, fathers, father. So what we're looking to do is any limiting belief systems, and we all have them. Any trigger that you have is a wound that needs healing. So when we're dealing with any thing like cancer or autoimmune disorders or anything of any magnitude, we're always looking at what is the underlying emotional conflict that potentially caused the weakness in the specific area where it has shown up. Oftentimes when we're looking and following the thread to that emotional conflict, we also find the healing that can take place because of the resolution, because all traumas are stories that have been created from something that is of past. And of course, that story can live on within the body, creating disharmony and dysfunction. So that's one of my privileges and my honors, working here at the Center for New Medicine, is to be working with patients very intimately and exploring some of their characteristics, behaviors, tendencies, labels, and also diagnosis that it could be emotionally based, which 99.9% are all emotional based. So that's a little bit of what I do at the clinic. And I'm going to talk. So Dr. Shannon, do you want to share a little bit about yourself?
Yeah. All right. Yes, I'm glad to be back at the Center for New Medicine and helping you guys out. I got into dark field microscopy because I primarily, and I was jumping from a 10 pass to EBOO ozone. And I'm sure that you probably had an episode explaining what ozone is. But my main purpose is I wanted to make sure I wasn't causing any harm by hemolyzing the red cells. And I started doing dark field microscopy when I was making that transition. And since I've been doing it, I've seen huge changes pre-COVID to now. And I think dark field microscopy should be done because you can see how you were affected by COVID. I see drastic changes under live cell microscopy. That's people have normal blood labs, and they have big changes on the dark field microscopy. Wouldn't be found otherwise. So I think it's sign that you were affected strongly, and then you can proceed with therapy. Dark field microscopy is a tool of the chest. It's not you can't make a diagnosis on it, but it will help you. It's kind of, I make the analogy like it's a red light that goes on in your car. It's like, hey, something's wrong. We got to find out what the root cause, what's causing these cells to change like this, what's causing appearance of them. So I think it's very useful. And I think in this day and age, with all the toxins that we're exposed to, everyone should have a dark field microscopy, because you can identify things that won't show up on your lab work.
Beautiful. Yeah, and it's so important to step outside the box when we're dealing with healing, because, you know, as you said, some of these things don't show up on LabPort, and you've been given a good bill of health, but yet intuitively, you know, there's something wrong, whether it's long haul COVID or, you know, the chemtrails that are, you know, that people don't talk about. And a lot of times doctors don't even believe it to be true. So it's, you know, again, something that you are taking it out of your finger, putting it up on a screen, and that is you. It's non-deniable, which is great.
Right. I was going to say that it doesn't go anywhere and you don't get the results a week later or 2 weeks later.
Yeah.
It just goes right out of your finger under the microscope.
Okay, beautiful. All right, I'm going to go ahead and do the next slide. So Theresa, I'll have you talk to you a little bit about your amazing self.
So, well, I've been here at the center for about 2.5 years, but I've been doing microscopy for 23. So I originally took training in 2002 from Dr. Robert Young, and then I took another course from biomedics in Chicago and another one from Dr. Giorgio at the Da Vinci College in Greece. And then I also reviewed the training materials from Dr. Botha in South Africa. So I compiled a huge database of what each one said about each blood abnormality, what the causes were, what it meant, and I pulled all the common things together into what I report. So there's little differences between all of them, but great alignment between all of them. So, and so I brought all that here.
I love it. It's good to have that bird's eye view, right?
Yeah.
Because we certainly get a lot more information when we're looking at it from above, rather than looking at it from this very narrow point of view, which can be the Newtonian mindset of treating.
Right.
Okay, beautiful. Let us continue on here. Okay, so what is live blood cell analysis? So Dr. Shannon explained a little bit in regard. So I'm going to go ahead. You're the expert, so I'm going to have you just go ahead and answer that.
So the way I explain it is that it's a qualitative look at the blood. Most of the blood tests that we do in the lab are quantitative. We're counting the number of cells. We're making sure we have the right ratio, the right sizes, the right numbers. But when we look at the live blood, we're really looking at the quality of the cells. Sometimes we also notice things that are off quantity-wise, but that's not necessarily the purpose. It can be a hint or a clue for other things that are going on, but we're really looking to see, are the red blood cells the right shape? Are there clues in the way the red blood cells look that show us how well you're processing your proteins or your fats or your carbs? Is there a way to tell if we're getting enough nutrients? And then we also get to see the activity of the white blood cells to see if we see the different types, if they're active or not. And then anything else that shows up in the plasma can also be a clue. We see a lot of signs that the liver is struggling in the plasma, and so that can be a help to the doctor to know how much support the liver needs.
Beautiful. And when you mentioned, quantitative, like say, for example, if you're, going through the blood and you're realizing, wow, there's, more of these white blood cells than these white blood cells. So that might mean that, I need to inform the doctor that potentially they need to take a test that would have to do in relationship to the lack of or the too much of. So giving that information again in the direction in which we could go, which is really important.
Right.
Okay, fantastic. So when we're looking at the blood, it's important for us to, like, as what she says, is just you want to look at just not one snapshot, but you want to look at the whole picture and create a story. So I'm going to go ahead and let you talk about, what should blood look like when it's optimal and when it's in balance, and you see a relatively body. I mean, nobody's going to be perfect. Okay, it's impossible.
Nobody, yeah.
We live in an unnatural state where the water, the air, the food, the TV, the religion, it's all been adulterated. So we aren't going to see. So when people come in, it's normal to see some of these things. Or like when people get a diagnosis that there's, parasites, or, they freak out. Well, guess what? We all have that because we have a terrain, which is kind of like the ocean, many, many species. But then when things either become deficient or excess of, that's when we have problems. So
Right.
just talk to us a little bit about why that snapshot would look really healthy and normal to you.
So the live blood, the red blood cells should be nice and round. We've got two pictures up there. One is phase contrast, the bigger one in the back, and then the smaller one in the front is dark field. And the only difference really is the way the light bends around the subject. So both of those show healthy cells. It's just the different lighting that shows different things. So in phase contrast, we should be able to see that little shimmer in the middle of each cell because the red blood cells are biconcave. And so they're a little bit thinner in the center. So that shimmer is the light from the microscope shining through the red blood cells. But they should have a nice strong halo, the membrane on the outside, just like what shows in the dark field. That nice strong halo also shows that outside membrane is a lipoprotein. So the light from the microscope makes it glow. And so we should see that. And we should also see that they're separate. They're not really overlapping or stuck together or smooshed together. They should be freely floating in their own space. If they're touching a little bit, that's fine because they are sandwiched between two pieces of glass, but we don't want them to be like stuck together like a honeycomb or rolled up on top of each other, like a roll of coins.
And that beautiful glow that you see around that, you said it's a lipid layer. So it's a fat layer. So
Right.
Again, that's what allows things to penetrate in and out. So it's kind of where the receptor sites would be to some degree. Okay.
Yep. I say it's like the gatekeeper.
The gatekeeper.
What gets in and out of the cell.
Yeah, and this is why it's so important to have good, healthy fats, because
Right.
every single one of these cells is made up of, you have a beautiful lipid layer around it, that lets things in and then also keeps things out.
Okay, so our presentation tonight is going to be about a lot of the common issues that we see. And so these two pictures are both pictures of fibrin. Fibrin network and fibrin spicules are both proteins that are triggered by the liver. So when we see this in the spaces between the red blood cells, or in between the white blood cells too, the spaces are the plasma that everything's floating in. And so when we see fibrin building up like this, then we know that the blood is getting a little bit thicker. And the liver triggers that fibrin to chain together from the fibrinogen. And so liver issues is probably one of the most common things that I see in almost all the patients here, whether they're healing patients on the cancer side or whether they're center patients just trying to stay healthy. Almost everybody I see now has liver issues.
And it's not a wonder because the liver has over 450 functions of the body in regards to what its basic job is. And as I said, it's having to deal with a lot of toxins that it never had to deal with. Now, when Theresa is pointing out the fibrinogen, she's pointing out the area that looks like a web.
Like a spider web,
spider web. Okay. And you remember just a moment ago, she said that normal healthy cells should be separate from each other and should not have the coining effect like you see on the slide here, where they're all stuck together. Now, if they're stuck together in the stickiness of the fibrinogen, which means that they don't enter the cell wall clumps at a time. They literally have to enter the cell one cell at a time. So a white blood cell, you've got to take it off of the line of defense to go and take out the garbage and clean up, some aspect of those red blood cells so they can actually be floating freely and enter the cell wall one cell at a time.
Right.
Okay.
Do you want to add anything, Dr. Shannon?
No, that sounds good. I agree. I think, seeing the fibrin can be it's multifactorial. There's a lot of different causes that can contribute to that, but that could be an indication that you have thick blood, your liver could be clogged. I've seen that a lot with the effects of COVID. Before and after, a lot of people will have the fibrin,
And Dr. Shannon sorry, go ahead.
Go ahead.
Would it alert you to want to check their D dimer if you saw this?
Yes,
If they've had
absolutely.
COVID or
I
long
would check their
haul
D
COVID?
dimer. I'd want to know. I'd probably put them on proteolytic enzymes. I'd want to, check their, So this is just one part of the puzzle, So when I would see that, I'd want to see, okay, what is their liver function test doing? What's their D dimer doing? Why do they have so much fibrin? But that's a sign that they could have clotting problems, down the road too. So,
Yeah.
you would want to put them on, make sure they're on a proteolytic enzyme to break that down.
Yeah, and a proteolytic enzyme is basically an enzyme that you take on an empty stomach so it doesn't interfere with your digestion, and it's looking for proteins that really shouldn't be floating in the blood because you haven't eaten anything. So this is why a lot of our patients that have, cancer, because any kind of virus or bacteria or even like cancer has layers of protein that it hides itself in, from the immune system. So when you're doing a proteolytic enzyme, it just goes, oh, there's a protein, and it starts to break it down, and then oftentimes can find, oh, this is a foe, it shouldn't be in here, and it gives the white blood cell an opportunity to break it down, get rid of it, destroy.
And I was going to say, I also have seen a lot more of this since COVID. That was something that at the very beginning of COVID, I think that I expected to see more like respiratory issues, but it was really a lot more circulatory issues that showed up under the microscope.
Marcus, I know you raised your hand, but we're gonna, if you could please write your question down or put it in the chat box, and I promise to address it at the end, okay? Then that way we can just kind of flow through these slides. But thank you for wanting some more information. That's great, we love it. Okay, so, and how about this slide here? Because we see all kinds of colorful little things in here, and little speculas all over the place.
So the slide on the right definitely has some of the fibrin spicules in it too, the little strands, but primarily in these pictures, I'm showing the fatty acids like cholesterol and uric acid. So the kind of orange color in the right picture is uric acid, and the more kind of goldish yellow on the other image is cholesterol. And both of those fatty acids are something that the liver should be processing for us, and in this picture it's not happening. So again, we need to add some liver support to help these fatty acids get utilized, because they are supposed to be utilized to make our cell membranes and to line our nervous system and to make our hormones. And in this case, both of these pictures, this is some that just went to waste. So we need to support the liver so it can do a better job.
Now, Dr. Shannon, if you would see a lot of these, uric acid, would it kind of trigger in your mind, to check for gout?
Absolutely. So if someone has elevated uric acid, you definitely want to see what the level is, and so if they have super high levels, they can manifest symptoms of gout. But it's also, they can get kidney stones, and also they can, uric acid can damage the blood vessel wall. So I'd be definitely, if I saw this, I'd want to know, okay, well, what's their level? Where are they at?
Right.
Beautiful. So in here, we got, this looks psychedelic.
Well, these are some pictures of some fungal markers, candida and symplastes. That's just meaning a grouping. And so in both of these pictures, we see lots of individual little candida, the little white, almost translucent little bubbles. And then we also see some elongated candida, which is in the right-hand picture, kind of on the right-hand side, almost looks like a little snake or tendril going around that red blood cell. That's a more like evolved or developed type of candida. And then on the left-hand picture, that's a grouping, a huge grouping of fungal markers. Platelets are grouped in there too. And so all of those are signs that there's some gut dysbiosis, the leaky gut. A lot of times candida originates from the gut because it's part of the flora that's supposed to be there. But you don't want it in your bloodstream because then it's going to be stealing your energy and producing more toxins that your liver has to filter out.
Okay. So now it's body's being invaded to some degree because it should remain in the gut. So now it becomes, what is that called when it's outside the gut and it's in every area of the body? There's a word I'm looking for, but I've had 7 hours worth of work today, so my brain's not all on.
It is systemic.
Systemic. Thank you very much.
Yeah.
So it becomes systemic. So now maybe because, like I said, in the the gut is kind of like the ocean. You're going to have many species in there, but when we start having an excess of or not enough of, then it becomes a problem. And what should stay in a specific area now it goes out into the bloodstream and becomes again can go anywhere, right, into the brain area. And this is all this brain fog. And the thing about candida, because it's fermentation process, if you have a high level of candida and you get pulled over by a policeman and they breathalyze you, you can actually be pulled over for elevated alcohol levels because of this. And so that's why a lot of people have a hard time with their thinking and they're tired. And so fungal is a big thing. And most oftentimes when you have a compromised immune system, you're going to have, I call this, the gang, it's just like they're all together, the fungus, the parasites, the virus, the heavy metals. And so again, we want to do a house cleaning. So it's interesting because when you said that fungal that's elongated, it almost to me looks like a parasite. Can you just can you see parasites?
So usually I don't see parasites in the blood because there's not all, they usually stay where there's food, which is in your gut. And so there's not a lot, I haven't seen hardly any in the 23 years that I've been doing this where there's an actual parasite, at least at the magnification that I have.
Yeah.
So.
And Dr. Shannon, have you ever, scraped somebody's plaque on their teeth and then seen the, spirochetes in that? Which are parasites?
I honestly haven't done that.
Yeah.
But I've read about it.
Yeah.
So,
I did that one time when I was doing, the microscopy and stuff. And we were like, oh, wow, look at those things moving around.
I was going to say, and it doesn't even have to be tooth plaque because I did it with someone who had oral cancer. We were trying to decide, so you can see the spirochetes in that. Yeah.
Yeah.
So,
is it,
but see, I would classify spirochetes as a bacteria, not necessarily as a parasite. I know a lot of parasites are bacterial.
They're pleomorphic. They can change into, they're sneaky little guys, right?
Yeah.
Okay. So most of you have been told, if you come to do a scan with Molly or, an LSA or an Asira, that, you've got an overload of fungal. And oftentimes we put you on a 3-month protocol of, really reducing the sugar content, the fermented foods, and really trying to, balance out the gut so that we don't have dysbiosis. So again, it's something that it's never you're going to get rid of it completely, but what you want to do, I would say it's like a golf course lawn. If you don't, mow the lawn, the weeds grow way faster than the golf course lawn. So you want to just keep mowing it down all the time because you're not going to completely get rid of it. So you don't have to have, so it's just like this is the bottom line. I mean, you kind of have an idea sometimes when you eat food and all of a sudden you get gas and bloaty, or you get itchy skin, or, fungal on your feet, or vaginal yeast infections, or you look at your tongue and it's all white, you just go, oh, there's a little bit too much in there. So we don't want to be judging ourselves, but we want to be fixing ourselves. Okay, and here, looks interesting. These look scary.
So these are just some red blood cells that are misshapen. So poikilocytes is the technical term for red blood cells that aren't nice and round. And so there's 3 different shapes here that I'm pointing to. So the crenating edges, those are the ones on the far left. Those are kind of like, almost like a little flower. They got little rounded edges around. And so that's a sign, again, of the omegas not being sufficient, or maybe not being processed well by the liver to make a nice, smooth, round outside lipid membrane on the cell. The dicryocytes are the ones that are lemon shaped, kind of to the right side of that first image. The lemon shapes indicate that maybe proteins aren't breaking down real well. So this might be lead to a discussion about chewing more and not drinking so much water while you're eating, because that dilutes your stomach acid and then you can't break those proteins down so well. or maybe you do need to have some help in the form of digestive enzymes or even hydrochloric acid to help break down those proteins if that's an issue. And then the ones on the far right, the echinocytes that look like little bottle caps or burrs, sometimes they call them a burr cell. Those are usually a sign either of weak digestion, not getting enough B vitamins, or sometimes liver or virus, and actually even chemical exposure can cause those too. So there's lots of things that can cause them, but they do make it harder for the cell to deliver oxygen because those little bumps kind of keep it away from being able to make good contact with the blood vessel wall in order to give off the oxygen and nutrients that they're trying to deliver.
And now, can you actually identify like free radicals in blood? Because sometimes I used to think of those like a free radical to some degree, right? You know, when they have the like little spikes, like they look like the little.
So I don't know. Like I've never used that terminology,
Yeah.
so I don't know. Like I know free radicals are
Like you don't want them.
Yeah.
They use up your good electrons,
Right,
right?
yeah.
You need.
Well,
Go ahead.
free radicals can cause damage to the lipids, and that can cause the cell wall to break down. So,
Right.
you know, like if you do too much ozone, you know, it'll cause
Right.
damage to the lipids. And then so you don't, so an effect of free radicals, too many of them can change the cell wall shape.
So the echinocytes could be then a sign that there's free radical damage, but you're not seeing the
Yeah.
actual free radical, but the free radical damage.
Right,
is there.
right.
Right. Yeah.
Exactly.
Okay.
And that could be one of the causes.
Yeah. Okay, and so this is a grouping of pictures that show protoplasts, which are groupings of proteins, sometimes fats, sometimes toxins. Usually the bad thing about them is just that they're so big and they have a really hard time circulating. So that they're various shapes, all different sizes, from one that's the same size as a red blood cell to one that's 4 screens big or more. It just depends. I see it a lot. We see it a lot more since COVID. Sometimes like the middle picture there has that blue spot on it, that's lactic acid. So fatty acids are joining along with proteins and other toxins to form this like little island that has a harder time circulating just because of its size.
So when you and I were talking a little bit about this, when I was talking about protoplasts, it's kind of like you said, just a little bit, it's kind of the debris, you know, and bacteria and things of that nature. And so what I was taught that, like, let's just say if they're housing, they're like a snake skin, right, to some degree, and they're housing stuff inside, and when the edge is frayed, that it's actually now released that was inside and being housed out into the bloodstream, and then now it becomes just like the snake skin, you know, and the white blood cells got to go clean it up, right? How about Dr. Shannon? How about you know, in regards to these protoplasts and a little bit about that?
Yeah, I see since COVID, I see a lot of strange things in people's blood, put it that way. And I see them self-replicating. I see I've never seen anything like that before. And there's been a drastic change in people's blood that people need to be aware of from when I started doing it before COVID to after COVID. So once again, I think it's an early precursor. It's everybody has to see how they were affected by COVID. And I really think live cell analysis will give you an early time to jump on it, because until you start manifesting a lot of symptoms and a lot of problems. And you can see the difference once you start treating them and try to do, you know, I dose vitamin C with calcium EDTA, and you do it, and you do live cell after you give them an IV, that there's big changes. So it's cleaning up all the toxins that are in their blood that was affected by COVID.
Yeah. Okay, good. Glad we have this tool.
Yeah.
So this is a different type of blood we're looking
absolutely.
at. Yeah.
So yeah, the dry blood analysis is sometimes called the oxidative stress test. And so on this test, we let the blood dry on the slide without a cover slip. And we're really evaluating how the blood clots at this point. And so healthy blood should have a nice bright red color and even consistency with a lot of like black cobwebbing. Looks kind of like a cobweb. Or sometimes I say it's how I think my brain looks, if you could take off my scalp. But it's supposed to be nice and red and nice and tight. So if there's white holes or other anomalies, that can give us clues to what's going on in the body. So go ahead and roll to the next screen. There should be, you can see on the right side here, some little teeny white puddles. Those little white protein pools represent inflammation and toxics build up in the body. And so the smaller those holes are, the healthier it is. The bigger they are, the worse it is. On this test, we do 8 drops. And the first drop shows us the things that are the most recent. Things that are shallow, temporary, surfacey, haven't been there very long.
So would you say on an average of like 6 weeks up to 3 months current or
Well, it's kind of hard to put a time frame on it because everybody's different. But I would say because it's showing us the most current things, the red blood cells live an average of 4 months. So I would say, maybe 4 to 6 months on that one. That's all. And then as we go down the layers to layer 2, 3, 4, all the way down to 8, we just go gradually deeper into the body, further into the history. So things that have been there longer, they've been brewing longer, so they're going to take more work. So the really chronic stuff shows up down on layer 7 and 8.
So it's a real timetable.
It's kind of a timetable, and it tells then the doctor like how long something's been there, which kind of gives you a clue as how much work it's going to take. Right? Because if you've been dealing with something for 2 years versus 20 years,
that makes a big difference. Yeah, it's a
Yeah.
lot easier to prevent than to treat, right?
Yes. And so on each one of those drops, we have a ring pattern that points to different parts of the body. So this is kind of like, I say, like the rings of a tree, or it's actually let's see, what do they call that? No, I lost the word. It's
the
like,
end of the day,
like how your whole body is on your hand.
Oh, yeah. The
Or
map.
your foot.
Yeah.
Yeah, the map of the body. So the map of the body is on the blood too. So if we see things that are in the very center of the drop, that's the center of the body. So that's where we see things that are like reproductive issues and elimination issues. And the skin and the extremities are on the very outside edge. So depending on where we see things, that can also help the doctor to maybe put a treatment right where it has the most effect.
Okay, beautiful. I love that.
So the white holes, they're called protein pools or C-reactive protein. Those are what gives us the clue of where the inflammation is. So it's better to see small holes that are round and clear, that don't have anything in them. But if they have a more irregular shape or they have things in the space, then that's more higher valence, meaning it's more problematic. So we want to see smaller holes if we do see them, because that's less inflammation.
And then of course, with the ring mindset, where those larger holes are going to be a representation of the organ systems that they're in as well.
Or the parts of the body.
Or the parts of the body that are affected, which is great, because then you're taking the guesswork out and you're saying, oh, okay, right here, it's in the, it's in the lungs, the kidney, what have you. Okay, that's great. Okay.
So again, going back to common issues, lymph is one of the most common things we see. So mild, moderate, and severe, you can see the size of the puddles increases. They're all in the lymph ring, which is considered ring 5. The ring pattern is just kind of indelible in my mind, so I can just look at a drop and see where the ring is. But this image helps so the doctor can tell if it's a lot or a little. So the person on the far left doesn't have very much lymph inflammation, so that's good. The person on the right has a lot. So our lymph system is kind of our sewer system. That's where the trash goes.
Yeah, we got to take a shower, right?
And so we want to, keep taking the trash out. But nobody really ever taught us that our lymph moves when our muscles do. So that should be a reason why we exercise. But we should.
Yeah, absolutely. Okay, beautiful. Now let me ask you this. When I'm looking at that red blood cell, that says mild, can you detect heavy metals? Like, for example, if you see a black rim around it, would that detect, mercury? Or I don't know if is it mercury, or you can't really isolate what metal it is.
I can't tell what metal it is from this test, but yes, at the very outside edge, it can sometimes have like a real thin, dark black or gray line. Sometimes there's chunks, and then sometimes even further out from the edge, there's chunks that flow out towards the outside edge. So the heavy metals always end up on the outside. And so, yes, I don't recall if I have pictures of that in this handout or in this presentation, but we'll see.
So again, that would warrant also too, is to ask questions. Do you have, any amalgam in your mouth, blah, 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 because, we're all going to have some heavy metals.
I was going to say, and we used to see a lot more things like mercury, but now when we do the oligo scan here that measures your heavy metals, we're having a lot more patients that have aluminum issues, because that's one of the things that they're spraying up into the atmosphere. So aluminum is another heavy metal that a lot of people are having issues with. And aluminum cookware and deodorants and things like that. So there's a lot of exposure.
Yeah. Do you want to share anything, Dr. Shannon, on this one at all?
No, I think that's great. If I see the black line, I like doing an oligo scan along with the live cell analysis and dry blood, because you get instantaneous results right there, and I have a microscope here in Puerto Vallarta along with the oligo scan. And so when patients come out here, I know what I need to work on. And so I think it's, you don't have to wait for a provocative heavy metal test, and you get the results right away, so you know what you're dealing with.
Yep. Okay. Love it.
So these are the gut, basically. This shows the permeability of the small intestine, again, by the size of the holes and by the number of the holes. So mild, moderate, and severe images. And so I always provide the images for the patient and for the doctor so that they know kind of what they're dealing with. Because a lot of people have gut permeability, some leaky gut. Sometimes they have symptoms, sometimes they don't. But this, again, gives the doctor a better idea of whether it's something that, really
further testing
needs attention. Yep. And also, again, how long has it been there? How long has it been brewing? Is it something that's been affecting you just for the last few months or the last couple of years, or has it been a lifelong issue?
And you can tell that based upon
the layers, the number of layers that it's on.
Okay, all right. Yeah. So it's like, it's in all the layers, and we like on the severe aspect. Then we're really looking at any kind of issues that have to do with the gut permeability. Okay, got it.
Yeah, because the ring pattern shows up on all the layers.
Right. Okay. Yeah. All right. All right. Great.
And so these are pictures for a very upset and toxic colon. So on the very mild side, you can see where it's just maybe a little bit darker gray in the center with a few little small holes. And then on the very far right, you can see a lot of black with a lot of big holes. So a lot more inflammation, a lot more toxic buildup in the colon on the severe side. On the mild side, it might be a little irregularity, maybe a little diarrhea or constipation from time to time, not anything really significant, although that can still be an issue, and it can be a clue or a hint for other digestive issues or other things that are going on. So the doctor definitely needs to know about that, but at least from the pictures, they get the idea of what severity they're dealing with, again, to help them decide what kind of treatment is required. And
so when it goes from that kind of, cherry red to black, that looks pretty severe. Is it like black, like a hole, like it's made like holes in the intestinal wall, or?
I would say more maybe like there's a lot of buildup and maybe some like mucoid plaquing and
Okay, so
and
one like the light can't get
diverticulitis.
through there.
Yeah, it's
'Cause it's
like
layered.
it's like impacted in there.
Okay,
You know,
all right.
like I don't know.
Do you have anything to share about that, Dr. Shannon?
Yeah, it'd be like a toxic, like, like it could be more severe Crohn's, or you would
Yep.
see something with severe inflamed bowel,
Light.
So I would, so you can't really, you can just say, oh, there's a big problem with the bowel. Can you tell whether it's Crohn's or cancer, inflammatory bowel disease? You'd have to do more of a workup, to kind of find out what's going on.
Yeah.
So
Exactly.
it's just a hint that there's a problem. There's a big problem there.
But I do find sometimes that patients, everybody's normal is their normal, right? Like, so they might think that eliminating once every 2 or 3 days is normal because that's the way they've always been. But we know that that's not healthy. You should be eliminating every day and probably multiple times every day.
Right.
But they might not know that. But then when you see a picture like this, they go, oh, well, yeah, I guess.
Constipation.
Yeah. So it's not always that it's something that the patient even knows. So
it becomes their norm because it's their experience. And so you have to say, well, I eat breakfast, lunch, probably snack, and dinner. But if I don't go to the bathroom till 1 or 2 days later, then it's like the Play-Doh factory. What's pushing out yesterday's food, And we definitely don't want that. You want that peristaltic activity as soon as it feels the sense of debris in there, that it starts doing its contraction. And a lot of times when you have constipation, you have the lax of the colon is just, it doesn't have that nice, peristaltic activity, that nice motility.
Yes, right. Okay, so these spoke patterns are right outside that center ring, and this is a sign of a mineral imbalance. So this often goes along with a little bit of colon impaction, because part of the job of the colon is to reabsorb those minerals out of the chyme when it comes from the small intestine. So I often see those together. But this is a sign then that we have to do something to help you absorb your minerals, maybe even supplement. So again, this goes along right with the oligo scan. Whenever I see this, that's the first thing I recommend, so that we can find out what minerals are being involved. Very often these are the bigger minerals like calcium, magnesium, not like trace minerals. They're the ones that make up your bones and teeth. So. And then these are pictures of inflammation. So again, like we said at the very beginning, the little white puddles show kind of the severity of the inflammation. So smaller and rounder is better than big and irregular. And then of course, where they're located in the drops. So the more inflammation, the less actual connection, like the bottom right picture, there's hardly any red and nearly no black that we're supposed to have, where the red and black are connected.
Like tight junctures as well.
Yes, exactly.
So do you see a lot of this type of a blood, when you're dealing with someone who's got chronic situations, or, cancer, or just really severe inflammatory responses?
Yes.
Yeah.
Absolutely. Yeah.
So if there hasn't been a diagnosis yet and you see this, it may warrant the idea of the further testing, and just kind of say, okay, what is this soil capable of producing? We are in a state of brewing, and then again, that inflammation is to treat by preventing first.
Right. And inflammation's implicated in every disease process. So the more inflammation that you have, the harder it is to heal, because it's like you're trying to put out a fire while you're trying to heal. And so you want to get that inflammation under control. And then in the dry blood analysis, it's also a way to track and see how that's improving. So I've got I did some short studies with patients here who had really high inflammation. And then I just tracked how they did on their protocol using like curcumin IVs and hyperbaric to see that blood come back together and heal and present as a real connected clot again. over time. And that can be very encouraging for patients to be able to see that, because there's not really, I don't know, any other real visual way for them to see that,
And so, you would want to maybe recommend this test like every 3 to 4 months, when
So
the blood changes over.
Yeah, exactly. The red blood cells live 4 months on average. So I usually say 4 months. A lot of the patients here come back on just like 6 month or annual. So I always recommend doing a recheck at that point so that you can see how things have changed. And I always do a direct comparison with what we saw last time so that you can see where anything's improved or anything new has cropped up. And if you're checking every year or every 6 months, you're going to catch something right away so that it doesn't get to be a bad thing.
And plus, it's going to motivate you. If all of a sudden you see this severe, and then 4 months later I go back and I'm just like, okay, you know what? My effort has produced this, so why would I not continue with this effort?
Exactly.
Right?
Yeah.
Lifestyle.
Yes.
Okay. Oh, okay. So it's just question time. So anyway, we do have, I think, some in the chat box. So again, don't hesitate. There's never a dumb question. Your question might be something that somebody else is also thinking about. So just feel free to be vulnerable. This is a safe space, okay? So let's just have a look here in the chat box. So let's start from here. Will there be a link to recording after the webinar? Yes, usually what we do is the next day or so, we send you out, a little, do we usually do that?
Days.
Oh,
Yeah.
okay. So
we edit it.
okay, so usually we're going to edit it within the first, maybe 4 days or so. You should be able to have a link to watch it. Okay, so you can share with other people that you feel that you would love to share this information with. Okay, you already answered that. Okay,
Yep.
All right. Oops, let's go back to Marcus's. So I'll let you answer that.
How the blood cells take out the garbage and bring in the essential nutrients. So the blood cells, the red blood cells, are more about delivering the nutrients.
The oxygen.
The oxygen and nutrients they pick up at the lungs and the small intestine, and they deliver it to the rest of the body. Sometimes I compare the red blood cells to the semi-trucks, right? They say if the truckers stop running, all the stores would be empty in 3 days. So we need the red blood cells to be delivering our nutrients and oxygen to every other part of the body. The white blood cells are the ones that are taking out the garbage. So they're picking up what's not supposed to be there and taking it out through your lymph system so that you can eliminate that. And then the lymph eventually empties into the colon and the lungs. So the white blood cells take out the garbage, the red blood cells deliver the nutrients. I hope that answers your question.
Okay. So this is about the acanthocytes.
Yeah. Do the burrs hurt normal lipid coatings of other cells? Marcus, I'm not sure that the burr cells hurt the lipid coatings of the other cells, but you might have heard as we were continuing to talk about that, it's a sign of the free radical damage on the lipids of those burr cells. So if there's free radicals that are damaging the burr cells, then they're going to have the access, I suppose, to do that to the other cells as well, depending on how many free radicals are there. So it's not the burr cells themselves that are causing the damage, but the free radicals that are there.
Okay, beautiful. What is your thought on using alkaline water? I think it just jumped around, but I just had a second.
People are asking questions.
Okay, yeah. So let me see. There was one. What is your thought on using alkaline water to help with tissue acidity? And do you notice it having an effect on the live blood?
So I was going to say, I think what she was trying to say is we have to be careful with alkaline water.
Systemic acid.
Yeah. Okay, now just remember, the water that's coming out of the well, or it's the 7.4 pH, which is going to be normal. So, God didn't make water at a 9 or a 10. Okay, like what Dr. Shannon said, if we're going to be really wanting to change it, we're going to use bicarbonate soda, things of that nature, that we're going to very quickly change it instead of, this water. And I'm not saying there's anything wrong with Kangen water. I'm not saying that there's anything wrong with any of these machines. But again, every single glass of water you drink should not be alkaline water, because if you get too alkaline and you're a 9 or 10, your body's going to have to take, again, minerals out to create more of an acidic nature, because you need to have a balance, and the body will take from you to get, because otherwise, if your blood is acidic, you could you could die. Okay, let's see. How does the live blood relate to cancer diagnosis and treatment?
The live blood analysis isn't diagnostic at all, so it doesn't relate to cancer diagnosis. Most of the patients that have a cancer diagnosis that come here get live blood analysis, but it's just for those qualitative clues that can help the doctor in formulating a plan or a protocol for them. So it helps the doctor with more information, but it's not diagnostic by itself.
And somebody asked how to make an appointment. You can call the clinic at 949-680-1880 and ask for a live cell analysis. Okay, so let's have a look at here. How do you recommend detoxing candida for someone who has a white tongue?
Okay.
That's a better question for the doctor.
Yeah, you want to answer that, Dr. Shannon? I know you have a bad connection, so I'll try to fill in where.
Sure. Yeah. Sorry about that. For systemic candida, what's the best solution? Well, first I'd want to see, have you taken chronic antibiotics? Are you diabetic? What's your root cause? To what's causing you to have the imbalance? And so I treat a lot of people with ozone with systemic candida to rebalance them. And I think that's highly successful. You can also use fulvic, visualize, I should say. So I would probably, do Molly's test to try to see what supplements would best do it. But honestly, sometimes I need to put someone on diflucan for 6 weeks. So it just depends upon the severity that they have. If it's just a white tongue and there's no other indications, Molly test shows that it's not systemic, or the live cell analysis, I don't see anything in the blood, that's a different story. So it all depends upon the amount. So I'd first, you want to do a little bit digging to see how severe the candida is based on what the live blood analysis. Is it in their blood? Do they have any other infections? What do their toenails look like? Do they have if they're female, do they have vaginal yeast infections? But if it's just a white tongue, then that you could treat with herbs. You could treat with just swishing oil pulling or swishing with hydrogen peroxide. But if it's so you first would start with the least invasive things like herbs if it's mild, But if I have a severe case of candida, which I've treated a lot of people, I hit them with ozone, and then I go ahead and I do diflucan for 6 weeks and follow them up. I have to watch liver enzymes. That's for your severe systemic immune compromised patients that have the brain fog and everything else that goes with systemic candida.
And then from a diet point of view, you always want to say, sugar is what fuels most of these, uninvited guests and organisms. And so again, when I put someone on a candida protocol, then we're looking at, things that, are fungal and oriented. So oftentimes we don't have you taking mushrooms or the vinegars or, the fermented vegetables, even though they're fantastic for you to feed the friendly bacteria. But a candida issue says there's too much unfriendly over the friendly. And so if you're going to feed a prebiotic, it feeds both friendly and unfriendly, and then you get a lot of gas and stuff. So this is why, we want to treat it. And sometimes Dr. Shannon says we got to treat with big guns with just some medication first, if it is systemic, because it is something they can be all over the whole body, and especially into the brain area. And so, one of the things that you might consider is just, taking a tongue scraper every day, and scraping your tongue, and that would, because it's just debris, right, before you brush your teeth. But again, really starting to reduce the amount of glucose that you have in your diet. So if you're having, processed food and bad oils and chips and cookies and, bagels and pizzas and all these things like that, turn into an excessive amount of sugar, and also, breads and things that are fermented, it's going to feed that candida. And so, when I'm working with patients, obviously I'm going to, give them, the foods that are going to be more supportive to their gut, still, because food should be enjoyable and fun, but at the same time, it's not, people go, oh my God, this is so severe. I got to give up this. And I'm like, hey, well, do you want to also give up your gas and your bloating and your, and the fungus on your toes and the thickness of those toes? And they're like, oh, okay. So again, the reward is far greater.
You want to see.
Right. You're the ones see their hemoglobin A1C too, to see if they're diabetic or pre-diabetic, so that'd be important lab to also get, because those candida goes hand in hand.
And so A1C is a measure of how much sugar was in your blood over a 3-month period. And so again, if you're, a lot of times people, regular doctors don't check your hemoglobin A1C. They just do basically a fasting glucose, and a lot of people are really good metabolizers in terms of last night's meal to the morning, and they may wake up with a glucose level that's acceptable under 100. But then and so the whole time they've been thinking their blood sugar is great, and then they come to us, and we always check the A1C, and then they're shocked to find out they're pre-diabetic, or they've actually passed the line into type 2 diabetes. Which can be corrected. But most people don't realize that, a cup of rice cooked is about 42 carbohydrates, a sandwich is going to be 34 in terms of 2 pieces of bread, a potato 42, and all of a sudden they're like, oh my God, I just had 100 grams of sugar at a meal. And so when I start to teach the medicine behind food and the chemistry behind it, it's much easier to make choices that support the healing process in regards of when we're doing an elimination of the candida.
I think I was going to say right up there, I think there was a question about what foods are good to consume to clean your blood. And so that was one of the questions that was next, is what are the best veggies or fruits to consume to regularly help clean our blood? And I would say what I tell patients, and I'm not a dietitian or a nutritionist, but I know 2 herbs that really are good are parsley and cilantro. And so you can add those to your soups and your salads and on your sandwiches, and you can add those to juice. You can add those are both really good blood cleaners.
Oregano is fantastic. Cilantro. So again, you're looking for the greens in these, the phytonutrients, the chlorophyll. That's good. I mean, if you look at let's just say a chlorella underneath the microscope, or even spirulina, it almost looks like a red blood cell. I think that the only thing that's missing from a red blood cell is it doesn't have the iron in it, but it looks identical. So again, if you want to, help.
I think
it's best to test and not guess, so do an oligo scan, see how you're digesting and assimilating your food, see what's getting into the cell, or do a nutrient eval, because you need to kind of target, I think part of the healing is know what you're deficient in, because everybody's different. So I would test, don't guess.
Yes. Okay. Beautiful. Did I miss one here?
Can you see macrophages in the blood?
Can you see macrophages in the blood? Well,
aren't those just white blood cells?
Those are white blood cells. Yeah. So macrophages is just another term for white blood cells. So yes.
Yeah. So there's a variety of those, right? You've got your T cells, you've got your, white blood cells that have to do with allergies and your T cells.
Neutrophils, eosinophils, So yes, to answer that question.
Okay, let's see, blah, blah. How do you recommend toxin from candida? How do mycotoxins show up in live cell analysis?
Mycotoxins show up in the live blood analysis. They're the fungal markers from candida that we see, and also sometimes there's other forms that we can see that look more like, almost like a little mushroom that grows out of the platelets. That's more of maybe a sign of mold. There's branching forms of mold that we can see. It's not the most common. That's why it didn't show up on this presentation, because I was really talking about the things that we see the most often. But yes, we can see those mycotoxins showing up in the live blood.
So this next,
But that's not a specific test. So if someone's concerned with mycotoxin, I should get my micro lab done that to see if they have the antibodies to each mycotoxin, I think is more accurate, because I wouldn't rely on just a live blood analysis to say whether you have mycotoxins or you don't. You know what I mean?
Yeah.
Can you see Lyme?
So Lyme is a spirochete, and sometimes you can. It depends on the life stage of the
You can
Lyme.
see spirochetes, but again, there's
Yeah, more testing.
hide.
Yeah.
Yep.
Yeah. So, I mean, the main thing is it warrants for more discovery when we see these things, okay? So, as we said, it's not diagnostic in nature, but it's definitely can point the finger in the direction where we want to go and put our attention on. It says, is megablastic anemia common in most cancer patients?
I don't know that.
Dr. Shannon, you want to answer that one?
Megablastic anemia, you don't see it in all cancer patients. No, I would say no. It's individualized. It depends upon their nutritional deficiencies and what type of cancer they have. Are they just talking specifically about blood cancers, but you don't even see it with all blood cancers.
yeah, just as mycoplastic anemia. Yeah. Okay.
Come see me and I'll help you lower A1C. To just actually really recognize that everything from the plant kingdoms turns into sugar. And again, it's not just about food, it's about, what you're taking in, but it's also this stress that you have, because when you're under stress, you're going to produce cortisol, and cortisol is an action hormone that needs energy, and your body's going to dump glucose into the bloodstream. And then after the event is over with, it's going to go, oh, hey, I just dumped X amount of, amount of sugar into your bloodstream. Go to the kitchen and go get some chips and popcorn and go replace it. And so what we want to do is say that you are a chemistry equation. You're only really as good as your last meal. So we want to fix it each time in regards to what your body, how it speaks to you. If I get bloated, gas, or if I'm eating a meal and I'm not even finished with my pasta and my bread, I'm starting to do this, then we know that you're being intoxicated by excessive amount of glucose in the system. So again, I've helped so many people, even diabetics that are on insulin, lower their insulin levels, and also, reverse hemoglobin A1C, diabetic issues. It's not that difficult if you love yourself enough to be disciplined. Okay, so.
So I'm going to let you answer that, Dr. Shannon. It says, how can live blood cell analysis help someone battling chronic myeloid leukemia?
Yeah, well, leukemia is you're going to see overgrowth of immature white cells, and you're going to see it on live cell analysis. So would it help? It could help, see how you're progressing, or if things getting worse, so it's an indicator. It would, but it shouldn't be the only test, right? But you can see white cells, and with leukemia, you get a lot of immature white cells coming from the bone marrow.
Thank you. It says, I am a patient of Ariel's, and she recently told me of this blood analysis. I plan to take advantage of this procedure during my next visit. Will this test indicate whether I have a candida or parasite infection, or the extent of either one? So I think we covered that. So again, it can give us an indication, especially with the candida, the parasite, we have, different tests like the Firefly and things that we can actually, determine, what type of parasite it is and what is needed. And then we have other scanning devices like with Molly, they can say, okay, this particular product is going to be best to eliminate that. And, or, a doctor may want to use the big guns, like, we were talking about with the candida. And so you might have to use, Alinia or different types of parasite medications that might go in and big guns, and then later follow it up with, what we call the full moon kit. And, every full moon, for 5 days, you kind of do this parasite eliminating just as an ongoing. I mean, bottom line is everybody has parasites. Okay, everybody has candida. So it's probably really prudent to say, okay, I parasite my dog twice a year or however much I did. Shouldn't I just do that to myself, period? And so it's just a good maintenance. You know, we got a clean house here, and nobody's exempt from having parasites. So this one's probably going to be directed to you, unless you want to answer this.
No.
My galactin-3 and VEGF levels have been consistently in the high range. I take supplements to try to lower per my naturopath, but they don't seem to help. What do you suggest to lower them?
Okay. So when your galactin-3 is elevated, that can be because of inflammation. So a lot of times we give alpha pectin. I don't know if she's taking that. That can help bring down your galactin-3. When you have galactin-3 is elevated, it'll also elevated your VGIF. So that's vascular endothelial growth factor. So they kind of they can go hand in hand. So it's, again, you need to find out why is your galactin-3 going up? Do you have an underlying infection? You got to identify the root cause. It sounds like if those numbers aren't going down, you haven't found your root cause. And so that can go up because of cancers. It can go up because of infection. There's some kind of chronic inflammation that we need to do a deeper dive and get additional blood work to find the root cause of why that is going up, so that you can treat the underlying cause and not just treat the galactin-3.
Okay, thank you. Okay, I think we answered all the questions. How are we doing with time? Are we good? Okay, so if you don't have any other questions, I hope you enjoyed this episode. We love to be able to share, and of course, we learn so much from our patients. So again, don't hesitate to give us a call. We have so much to offer. I say it's an umbrella with so many things underneath it. I call it a one-stop shop.
Okay, Dr. Shannon, thank you so much. It was great to see you.
Yes,
And
thanks for inviting me.
Yeah, when I get to Puerto Vallarta, we'll come visit.
Yes, absolutely. All right, take care, you guys.
All right.
Good night.
Good night.
Anytime.
Okay, bye.
All right. Good night.
Night.